Are you curious on what really happens on a hair transplant procedure? For this episode, we will take you on a sneak peek of our usual hair transplant day. Let's go!
Good day everyone, and welcome to vlog number 6 at Hair Transplant PH, where we try to share with you facts on hair loss and the medical and surgical management of this condition. So again, if you, a family member or a friend, is suffering from hair loss problems, or you're just really interested in this condition, so join us. Just click and like and subscribe button below.
So finally, we were able to collect some video clips of what happened in a typical hair transplant day. So basically, a hair transplant is divided into 6 parts. So usually, we do first the pre-operative procedure, assessment, and then we do the anesthesia, and then the donor harvesting. After that, we do the placement of the holes, the insertion, and the post-operative care. So let's go to the procedure room. Dr. Regine, let's go!
Hello! We usually start a hair transplant procedure at 8 a.m. This box is full of ice. In a while, I'll show you kung para saan ito. Our patients will be greeted by our receptionist and will be asked to fill up forms and sign a consent. This is the waiting area if some relatives would like to accompany the patient. Our staff also comes early to set up the procedure room. All materials for harvesting and insertion will be placed on one side, while all microscopes, trays, and slivering pans set in a long table. Here you can see the materials that we use for harvesting. In another room, Dr. Jean, myself, and the patient will do pre-op assessment. We take photos, some measurements, and finalize the hairline design. The patient will be brought to the minor OR and requested to lie down prone. And we start injecting anesthesia. And yes, may libreng masahe dito. The massage helps our patients relax and distracts them from injections. For about an hour, the patient will be lying prone until we are done harvesting hair. The next step is graft preparation. For the strip technique, the bigger chunks of skin are placed under the microscope and hairs are separated into 1, 2, 3, or even 4 hair grafts. Remember niyo yung ice box na dala ko a while ago? Well, they're already placed under these stainless containers to preserve the hair grafts. For the strip technique, a lot of assistance will be required to separate grafts repeatedly. Sa FUE naman, around 1 to 2 cutters will only be needed since the grafts are almost prepared upon pulling from the scalp. If you notice, pwede makipagkwentuhan with the patient during the procedure. It's not that painful at all. While the assistants are still cutting, we make the holes and insert the grafts back to the scalp. And yes, they're placed one by one manually. This is a magnified view of the insertion process. And in real life, this is very small. That's why we need to use magnifiers all throughout the process. And this is the final result after insertion. A bit crusty, but soon all crust will fall down. Bandages are placed on the patient's head, post-op instructions are given, and you can go home. Ginagabi na talaga kami in a hair transplant procedure. You will be asked to come back after 5 to 7 days for checkup and suture removal for the strip technique. FUE, on the other hand, doesn't have any sutures.
So there you have it, a sneak peek on what happens during a typical hair transplant day. If you have any questions on this topic, you can just comment down below. So join us for our next episode as we talk about the topic medical or surgical management for your hair loss problem. See you then! Bye!